Okay, this video is from this book here, John McDougall, The Doctor Who Fought for You, by me, Pete Rogers. And really, it's chapter 17, which was frequently asked questions and the McDougall diet. So we're going to have a couple topics, and we're going to have Dr. McDougall talking about his own diet and why it's such a great diet. First of all, from newsletter July 2004 on coffee. You can just go to the drmcdougall.com website and see his newsletter on coffee. And we're going to summarize it briefly here. Coffee increases both cholesterol, total cholesterol, LDL cholesterol, triglycerides. Okay, so it increases your risk of coronary artery disease. Stupid. Raises your total cholesterol by about 10%. Basically, caffeine mimics the acute stress response. It increases catecholamines, adrenaline, noradrenaline. It increases cortisol, so it suppresses your immune system. It makes your blood a little more prothrombotic. Stress makes blood more prothrombotic, okay? It increases its tendency to clot. So that means it'll increase the risk. What is atherosclerosis? A blood clot. What causes a heart attack? A blood clot. What causes a stroke? A blood clot, okay? And then the other thing, too, is people say, oh, I'm stressed out. I need a cup of coffee. It's like totally stupid. You're stressed out, so you want to increase your stress hormones even more. It causes vasoconstriction, narrowing of the arteries to the brain, so it decreases your blood flow to your frontal lobe, so it does not make you smarter. I mean, don't get me wrong, if you're falling asleep, it can wake you up. It can perk you up in that sense, but it doesn't make you smarter. It decreases your ability to think in a nuanced, sophisticated way. It raises your blood pressure. Hypertension is a risk factor for atherosclerosis, of course. We talked about that plenty of times. Decaf coffee also raises blood pressure a little. There is some caffeine in decaf, just not as much as in regular coffee. It's upsetting to the stomach, increases gastroesophageal reflux, reduces the function of the lower esophageal sphincter. You're more likely to have stomach acid pop up into your esophagus and get that heartburn sensation. It's associated with increased risk of irregular heartbeats, and increased risk of activating atrial fibrillation. Some people get a little bit of a nervous tremor. It can cause anxiety in some people because it's really an excitotoxin. It increases glutamate. That's the excitatory neurotransmitter of the brain. 90% of the cortical neurotransmitters are glutamate, and it's an excitatory neurotransmitter, just like stress does the same thing. So it increases stimulation in neurons. That's an excitotoxic effect. It increases the activity of the NMDA receptor for glutamate. Not good. Stress does the same thing. You don't want to overactivate your brain neurons because then you raise their metabolic rate, and you need to make sure that the oxygen glucose delivery is simultaneously raised and that the mitochondria are functioning well in order for everything to go well. So what I'm basically saying is you don't want to be doing this on a routine basis. It's stupid. And then other people say, well, I heard, Matthew Shepard, the big, great, world famous sleep expert, saying that it's okay to have a couple cups of coffee every day. And the reason I'm going to say he did that is because he has to. You have to understand, for most of these guys on the internet, it's a business, okay? If he does not say coffee is good, he will not be invited to talk about sleep on the Bro Science channels, okay? You ever notice I'm not invited to the Bro Science channel? Because I tell you the truth, okay? I just do this as a hobby, so I'm just going to tell you the truth. All right, and you'll see other famous nutrition people that will also tell you, oh, coffee is such a wonderful thing. Notice that they will get invited to Bro Science or to a medical school, but I will not. That's because I'm telling you the truth, okay? Somebody needs to do the right thing and tell you the truth. That's what I'm going to do, okay? They're going to have to crucify me upside down to get me to stop doing this, okay? I'm going to tell you the truth, and you can take it or leave it, okay? Okay, and just like look at those phony plant chompers, Viva Longevity, they call themselves now. He won't invite me because he doesn't want the truth told to the public, okay? I'll tell you the truth about whatever I can, all right? I want you to learn. I want to try to help the pros, okay? Oh, yeah, and a bunch of people asked me recently, what is a pro? Pro's been around for a long time, that term. It just means the modern day term for the common man, the average man, the peasant, the plebeian of ancient Rome, the peasant serf of the Middle Ages, okay? The bourgeoisie, middle class. All right, what else can we say about coffee? Like I said, it's a vasoconstrictor to the brain. It's a brain excitotoxin. It mimics acute stress. I would recommend avoiding it, and it decreases sleep. Okay, Dr. McDougall's newsletter 2012. Should people avoid physical exams? And he says, yes, they should. The Nordic Cochrane Center, they do a lot of systematic reviews on topics. They used to have some really good people, like Peter Gochke. And they found that the general health physical exam did not reduce morbidity or mortality, but the number of new diagnoses was increased. Yeah, you don't want to have some doctor poking you around unless there's a very good reason. I can tell you, my mother died of colon cancer, so when I was a young guy, I went for colonoscopy because I was worried. My mom had it, maybe I'll have it. I had read in school, med school, family history increases the risk of some diseases. And the reason I share this with you is because the gastroenterologist did a physical exam on me before he was going to do my colonoscopy. And he's feeling my thyroid, he's palpating my armpits, he's doing like a million different things. And I'm like, what the heck is this guy doing? And so later on, I asked one of my internal medicine friends. And so the reason why he did such a thorough physical exam on me is then he can bill a higher E&M code, evaluation and management code, and get paid more money. So it was absolute nonsense. I was like in my early 30s, I was a totally healthy guy, 100% healthy. I was coaching a wrestling team as a hobby, okay? And he's doing this, extraordinary physical exam like, on a 90-year-old on me for no reason except he wants to bill for more money. And the reason that's a dangerous thing, what if he thinks he feels something in my neck? All of a sudden I'll get sent for a thyroid scan or some other BS. What if he thinks he feels the edge of my liver or my spleen or my aorta or something? I'll get sent for some other BS that I don't need. So I'm telling you, you don't want somebody poking around on you unless there's a good reason. Okay, Dr. McDougall newsletter, February 2005, popular diets. In the short term, at 1 year follow-up, most diets will lead to weight loss and often reduce several cardiac risk factors. But in the long run, it's a different story. Yeah, there's something called the Hawthorne effect, whereby just when you study a population, they start paying more attention to the details, and they do better than expected just because of that increased attention to detail. But what really matters is it sustainable long-term for life? Okay, so Dr. McDougall says, Dean Ornish said his low-fat, near-vegetarian diet was scientifically shown to reverse atherosclerosis, decrease angina, chest pain, bring about permanent weight loss, 5 years or longer, and reduce cardiac events, like heart attacks, 2.5 times. The other diets have no published research that shows benefits for heart disease. Yeah, and the Esselstyn diet's even better. 100% vegan, low-fat, no oil. And the reason I tell you this is there is no such thing in the paleo, keto, carnivore, low-carb literature or the Mediterranean diet literature. They have lots and lots of coronary artery disease and heart attacks, okay? It's only low-fat, low-sodium vegan diet that's been shown to reverse heart disease, or the Ornish, which was almost completely vegan. But Esselstyn's the best. There's nothing even close to Esselstyn, all right? Esselstyn had its closest competitor in like the Lyon study. It was about 32 times better than that optimized version of the Mediterranean diet. All that other stuff is nonsense. You need to know that, okay? And I can tell you this, I've never in my life ever seen a single university nutrition doctor that was worth a piece of crap, that was any good. None at all. They all tend to promote some version of the Mediterranean diet. Not even the vegan version of Mediterranean diet. So they're not even as good as the high-fat phonies, okay? So they're a joke. You need to know that. They all are. All the Ivy League, all the famous medical centers. When it comes to nutrition, they don't know what they're talking about. They haven't had any training on it in med school, and they don't know what they're talking about. And it's not in their interest to help you with nutrition and diet because you would then be cured of so many diseases, the hospitals would lose money. I don't expect that conventional medicine will ever teach, the low-fat vegan diet because it's not. They have a conflict of interest to do so. Okay, Dr. McDougall continues. The main reason most diets fail is that people cannot adhere to them long-term. You will notice that the McDougall diet is seldom included in research studies done by others. Yeah, they'll always say something like the McDougall diet or the Spartan vegan diet or the Esselstyn diet is too difficult for patients. They have no problem, cutting them open from stem to sternum for some surgery. They have no problem giving them chemotherapy where, tons of them die from it. But, to expect that they might eat 100% vegan, that's too much. No, it's ridiculous. Okay. Dr. McDougall says, the McDougall diet is based on the history of human nutrition, of human anatomy, and human physiology. The McDougall diet is focused primarily on health rather than weight loss. The weight loss comes with time, and it is sustainable. You never have to be hungry with the McDougall diet. The health benefits are extraordinary. The McDougall diet helps people to have a higher quality of life and to remain more productive. The foods recommended in the McDougall diet are very inexpensive. Yeah, starches are cheap. People save time and money by avoiding medications, doctors, and hospitals. There are clear rules with distinct boundaries that are easier to follow than moderation, which distinguishes the McDougall diet from other diets. Yeah, he's right about that. If you notice, like a lot of people, including a lot of the high-fat phonies, they'll always say, well, you should try to reduce oil, try to minimize oil. No, you should never have oil again. It's like a smoker. McDougall said, you don't tell a smoker to cut down or to just only smoke on the weekend. You tell them you don't smoke anymore. with an alcoholic. You don't tell them to cut down or only drink on the weekends. You tell them you don't drink anymore. The same thing with animal foods. You don't eat animal foods anymore. They really are bad for your health. I've made separate lectures where I compare animal foods to plant foods. Trust me, they're really bad for your health, and they're even worse than what I say in my lectures because I don't have enough time to say everything. And the more I read about them, I'm reading about kidney failure now. The worst thing you could do if you have a kidney problem is be eating animal foods. Okay, so yeah, having these clear-cut rules, and Esselstyn's good about it too. No oil, not one drop. McDougall says the same thing. That's what you want to do. So here's some research on the McDougall diet for a 7-day program, following 1,703 patients that ate the McDougall diet for 7 days with an unrestricted amount of food. You don't have to count calories or limit calories at all. They lost an average of 3.1 pounds in 7 days. Average reduction in total cholesterol, 22. They had an average decrease in blood pressure, 18/11. For people whose initial BP was over 140/90. Nearly 90% of them were able to come off their blood pressure and diabetic medications. Okay, do you understand what a big deal that is? Conventional medicine never, 0% ever cures hypertension or diabetes. McDougall in just 7 days cures it 90% of the time. To cure something means they no longer need medicines for it. Okay? Do you understand what a big statement that is? In 7 days, he cures 90% of hypertensive and diabetics, gets them off their medicines. That's big, okay? McDougall diet was also tested at Oregon Health and Science University with MS patients. 85% were compliant for 12 months. The McDougall diet ate 12.5% of calories from fat. The control group ate 37.5% of calories from fat. Average weight loss after 12 months was 19 pounds while eating unrestricted amounts of food. The average reduction in total cholesterol was 19. Patients noted a reduction in fatigue. Okay, there's another study done with the McDougall diet, and this was done in New Zealand. It was called the Broad Study. 1 year of community-based setting in New Zealand with 65 participants aged 35 to 79. Their average weight loss in 1 year was 25 pounds while eating an unrestricted amount of food. They were not told to exercise, but they could exercise if they wanted. Medication usage decreased by an average of 29%. Average total cholesterol reduction was 21 milligrams per deciliter. Reference right here is the paper, the Broad Study. Okay. Dr. McDougall, he says, you can expect these great results. He's shown numerous patients who lost large amount of weight and improved their health. So what I'm also saying is that's an extraordinary statement. This isn't like the typical TV commercials say, well, not all patients get these results. McDougall says, yeah, this is what they get. This is all patients, should expect improvement. Almost every single one of them. Yeah, maybe there's some exception here and there, but the point is it works for almost everybody, okay? Carl Lewis, the world champion sprinter and long jumper, had great success while eating the McDougall diet. You can look it up here if you want. Runner's World, August 1992. Dr. McDougall, our body responds to sugar with the output of more energy for exercise. Yeah, you tend to burn it, unlike fat, which you tend to store. Okay, Dr. McDougall continues. If you don't take estrogen replacement therapy, then fibroids usually disappear after menopause. The Western diet leads to an early age of onset for puberty in girls, about age 12 instead of age 16. And then it delays the onset of menopause a couple of years to about age 52 instead of age 48. And this increases the risk of fibrocystic breast disease, of breast cancer, of abnormal uterine bleeding, of fibroids, also endometrial cancer. So the prolonged estrogen stimulation wreaks havoc on the female reproductive system. Yeah, and they get a lot of symptomatic postmenopausal stuff like hot flashes, whereas you don't see that in the Asian women who have eaten plant-based diets most of their life. Nathan Pritikin pointed out decades ago that America was eating way too much fat. Pritikin said the best way to classify diets was based on the amount of fat. I've also heard Dr. McDougall say the number one biggest toxin in the Western diet is the excessive amount of fat. Diets that are usually high in fat. Diets are usually high in fat or they're high in carbohydrates. Okay, so when you eat animal foods tend to be very high in both fat and protein. They usually have no carbohydrate other than milk. A typical animal fat would be like salmon food. Animal food is like salmon, 50% protein, 50% fat. And those are terrible foods. Okay, fish is super acidic. It's terrible. Got a lot of fat as well. Lots of other pollutants in fish too, it's bad. Okay, so Dr. McDougall continues, the human body has over 60,000 miles of artery. Atherosclerosis doesn't just occur in the heart. The high-fat diets are causing atherosclerosis throughout the arterial system. Pritikin described the problems from a high-fat diet as lipotoxicity. Blockage of an artery in the heart is a heart attack. Blockage of an artery in the brain is a stroke. Blockage of arteries in the kidney causes kidney failure. Blockage of arteries in the Johnson causes impotence. That's the most common cause. Macular degeneration is the most common cause of blindness in adults. Macular degeneration is related to atherosclerosis, blockage of the arteries in the eye. Okay, and then here's one of his references on macular degeneration. He continues, blockage of arteries to the hearing apparatus causes hearing loss. Blockage of arteries to the foot causes gangrene. Blockage of arteries to the spine causes disc degeneration. Oh, this is sort of my words in here. Blockage of arteries to the gut causes bowel infarction. So anyways, I'm saying is, Pritikin was on the right track. Pritikin was a genius, and he was talking about when you cause blood sludge, you're diminishing oxygen delivery to every tissue in your body. That's why you want to eat low-fat diets if you're trying to heal something, so you get better oxygen delivery to the tissues. Okay, high-fat diets also paralyze the immune system. There's a lady named Lydia Lynch. She has a real good lecture on that. She's a PhD from Harvard. I think she just went to Princeton. The website was Immunotalks, Global Immunotalks. Okay, let's see. Dr. McDougall continues, when you eat a low-fat, starch-based vegan diet to prevent atherosclerosis of the heart, you are also helping to prevent atherosclerosis everywhere else in your body. Another thing to be pointed out is the glycemic index is quite overrated. Blood sugar is supposed to go up after you eat. Dr. McDougall says this all the time. Blood sugar is supposed to go up after you eat. For example, a boiled potato is a very healthy food, and it has a glycemic index of 101. Fructose has a glycemic index of only 20, but it tends to cause fatty liver and elevate blood triglycerides, so that's not so good. It's normal after eating a starch for your blood glucose to go up to around 140 to 150. Okay, if you want to see more detailed discussion of glycemic index, you can please see Dr. McDougall's newsletter from July 2006 called Glycemic Index is Not Ready for Prime Time. Okay, the real question with the treatment is whether or not it provides a benefit, or cures the patient, or helps you to live longer. One thing to watch out for is when you see a lot of industry-sponsored research or products, they're going to talk about relative risk rather than absolute risk. You really want to try to know absolute risk. Relative risk estimates can greatly exaggerate the benefits of a drug. All they have to do is compare it to a lousy drug or to a lousy treatment or a placebo, and they can make the drug seem great by comparison. However, in some cases, the drug has very little or even almost no absolute risk benefit. Something that benefits about 1 out of 1,000 patients for the condition treatment, but has potential side effects in almost all of them. So I would also warn you, watch out when you see these drug studies where they studied, 3,000 patients. The reason why they're doing it with 3,000 patients is because there's so little benefit from the drug, they have to get big numbers in order to tweak a fake little benefit. Here Dr. McDougall mentions Fosamax. He said Fosamax is proclaimed to have a 50% relative risk reduction for fractures, but the actual absolute risk reduction is only 1.7%. And Fosamax has many potential side effects that a person can't lay down after they eat. It can cause severe bone pain. It delays fracture healing, and at 7 years, one might have increased risk for fracture and even get jawbone necrosis. Okay, that's a lot of side effects. Okay, the Bantu women who had hardly any calcium intake and had 10 kids, they don't have a problem with fractures. Notice how there's a big difference between the sound of relative risk and absolute risk. Upon hearing that Fosamax has a relative risk of 50%, the average person might think, I'd be foolish not to take it. But upon hearing that the absolute risk reduction was only 1.7%, then you can make a more informed choice. Okay, this is from Dr. McDougall, a video on where he disputes major medical treatments. Okay, Dr. McDougall's 2009 newsletter, Real Healthcare Reform has health as the primary goal. In 1986, shortly after starting my 12-day live-in program at St. Helena Hospital, I had several meetings with representatives from major medical insurance companies with the intention of having my treatment called the McDougall Program paid for by the patient's insurance. I showed that the program would cost about $5,000 instead of cardiac bypass, which at that time costed $45,000, if all went well. I expected a favorable response from the insurance companies. However, the insurance companies were not interested. That's a big statement there. Why wouldn't they want something that would cut their costs? No, the insurance company want the cost to be high as well. They said my program required the patients to change their diets, and the insurance company didn't believe they would. They said open heart surgery doesn't require any cooperation from the patient. They just lay down on the table. I pushed my arguments further, but they still would not go for it. Then one of them said, "Don't you get it? We take a piece of the pie. The bigger the pie, the more we get." In 1978, the day after my graduation from internal medicine residency at the University of Hawaii, I told my former boss that 80% of the disease I care for is caused by the rich Western diet, and that most of this sickness could be greatly benefited or cured with a change to a starch-based diet. His disgruntled look on his face made me think that he would have torn up my diploma if he had a chance. My former boss told me, "Look, John, I like you and your family, but I'm concerned that you will starve to death with your crazy ideas about food. All you will collect for patients is a bunch of bums and hippies." My response was, "Well, so be it. Then I will starve, because I cannot prescribe drugs and surgeries that I know will do my patients more harm than good." More importantly, I think my former boss was really trying to sell me, what he was really trying to tell me was that I was going to fail financially because I was not playing by the traditional rules set by years of economic pressures to have a successful medical practice. The way for general doctors to make a secure living is to collect a whole bunch of patients and get them hooked on medications for blood pressure, diabetes, cholesterol, pain, etc. I departed from my former boss's office with these words: "I believe you are wrong. My practice will be made of successful people who have made great sacrifices to get an education, built businesses, and developed successful relationships. These people will seek me out to improve their health. History shows that I was right." This is all Dr. Mcdougall talking. "History shows that I was right and he was wrong. I am the luckiest doctor in the world. Not only do I make an adequate income, like most doctors do, but I also have the satisfaction of seeing my patients heal and stay healthy, like most doctors don't. Sick people take medications. Healthy people don't." Yeah, and that's true. Mcdougall cured more patients than any other doctor who ever lived. And he's curing hypertension, diabetes, obesity, coronary artery disease left and right. Whereas these things are never, ever cured in conventional medicine. Okay, so the point of all that was the insurance companies are in on it. That's why it could never be fixed. That's why I always laugh when somebody comes along and says healthcare reform. Yeah, right, you idiot. You don't even know what you're talking about. And if you do know what you're talking about, then you're a liar and a BS artist. Because you can't, if the insurance companies and the drug companies are making $1 billion, you think they're going to allow anything to change? The only thing they're going to change is they're going to reduce the cost of the provider. That's why they're replacing internal medicine, family practice doctors with nurse practitioners, because then they pay the nurse practitioner less, but they still get their drug money. In the future, they're going to use artificial intelligence and probably with an RN or a pharmacist, so they'll still get their drug money, but the provider will be paid less. That's the purpose of it. You're going to find it almost never has anything to do with improving patient care. Only chumps believe that. Okay, Dr. Lundberg made some statements. He was a former editor of JAMA. Dr. Lundberg said, "I believe there are still many ethical and professional American physicians and many intelligent American patients who are capable of, in an alliance of patients and physicians, of doing the right things. Academic medical centers should take the lead rather than continuing to teach new doctors to take the money and run." Yeah, right. All the academic medical centers, they want money, okay? Money talks. BS walks. The pros have no money. Money comes from drug companies and it comes from insurance companies. The pros don't have enough money, so nobody takes them seriously. Everybody says they take them seriously, but you go to hospital meetings at any Western hospital, they will talk about productivity and efficiency. They will never, I've never heard a place talk about outcomes. If they talked about outcomes, somebody would come in with the low-fat vegan diet and get the best results and change everything. Okay, then Dr. Mcdougall added, number 1, require all doctors and dietitians to teach a starch-based diet. Number 2, earnestly promote clean habits and exercise. Number 3, make baby formula by prescription only. Number 4, outlaw the sale of oral diabetic medications. Of all oral diabetic medications. Number 5, treat elevated blood pressure only if sustained for months at over 160 over 100. And use chlorothalidone to bring it down only to 140/90. Okay, that's what Dr. McDougall thinks is necessary for healthcare reform. I'm a little bit stronger on this subject. Okay, Dr. McDougall had a big business, so he can't offend people. I can offend people because I don't have a business. All right, I just do this as a hobby. And what I'm going to tell you is, you can't get around it. You have to have a Bible-based worldview. You have to say man is created in the image of God and therefore part divine. Therefore, he is entitled to our best effort, regardless of the cost. Okay, as Jesus Christus said, that which you do to the least of my brethren, you do unto me. Okay, you have to go by that, because unless you go by that, like the way a parent loves a child, there's always going to be a ton of money, and people are always going to go for the money unless they have that strong of a commitment. So that's why I think all this healthcare reform and new technology is really, for the most part, kind of a big joke. Okay, so that concludes that chapter. I hope that was helpful.